Hi, my name is Mark Silver. I'm a forensic and mitigation expert in New York City. I have undertaken thousands of cases over the years for criminal immigration and other lawyers. And I've taught tens of thousands of immigration and criminal lawyers and others. I've written books. One of the books I've done is this book, Borderline Personality Disorder, Survival Guide from Chaos to Authenticity. And I really wrote it as an outgrowth of my work in forensics, but I've gotten some very positive feedback from lawyers and clients and even family members who are not in need of my services in forensics over the years, who are very encouraging about the outlay of the book and some of the ideas. And what I hope to do in this program and in the videos to come is to present highlights of the book with particular regard to understanding borderline personality disorder, a broader conception of the criteria, and some ideas about what it means and how to intervene to assist family members. So I'm going to begin at the very beginning of the book itself in this first video. I want to just say that obviously this book is written for people with borderline personality disorder, but I don't want the label to be taken in such a way that it's exclusive, meaning that there are many people who will read this book and benefit and understand different aspects of the book, even though they don't have borderline personality disorder, and other people who perhaps do have borderline personality disorder may read the book or listen to these videos and latch onto or benefit from just a few aspects of what I'm presenting. Clearly, this is for family members. This is for anyone who has friends or loved ones with borderline personality disorder and wish to gain a better understanding. One of the reasons these videos and these kinds of books are so important is, in general medicine, we have the incredible advantage of empirical evidence. You can take blood work, you can, check the heart and the brain through tests and so on. All sorts of evidence to gain understanding about medical issues. We don't really have that in mental health. We can give self-report tests and other kinds of tests, but they don't really yield a very clear understanding of the mental health problems. And that's one of the reasons that psychiatric issues in general are so challenging and so very serious, particularly as we've seen all sorts of very negative issues grow in the United States, including levels of anxiety, alcohol and polysubstance abuse, and sadly, of course, increasing levels of suicide, particularly with certain demographics in the United States. The book is subtitled, the book is Borderline Personality Disorder. It's subtitled Survival Guide because I do believe this is a very serious disorder. It can be disabling, and we want to give the person a better sense of how to feel safe and secure and stable and authentic in their lives. Every mental health issue, any personal problem can exist on different levels of severity, and certainly because of the inner emptiness, sadness, anxiety, confusion, impulsivity, emotional ability, terrible feelings of loneliness that may rob the person of their personal dignity. Many people do in fact suffer horribly, and it should be considered as a true illness. When a borderline feels damaged, he is feeling the cumulative product of genetic, that is nature, and environmental nurture influences. Our genetics are set, our caregivers are set, our environment is generally set. We have few, if any, choices about which schools to attend. Our socialization is primarily set. And even our religious beliefs and value systems may be set due to cultural mores and traditions. There is a corollary to this crucial, very crucial issue for parents to understand. We can do relatively little for our children because so much is indeed said in their lives. Parents protect children from physical and emotional harm and trauma that the child's developing consciousness cannot anticipate or necessarily comprehend. The healthy and mature parent entices the child to fall in love with learning, which is curiosity, and life through exploration, which may even yield positive epigenetic changes in a safe home with unconditional love, and act as good role models so that the child can grow up enjoying proper regard for self or other with appropriate trust and good judgment. So our ability to control our childhood experiences or environment is actually quite limited. And by the time we do have control over our lives in early adulthood, we have already been directed to behave, feel, and think in a circumscribed manner. At some point, we need to take control of our lives maturely and thoughtfully, and this is even more true for the borderline who has felt helpless and unable to change his experience or environment. So this book will hopefully help the borderline to understand and control behavior, emotion, and thinking to live a more meaningful and dignified life. My most important conclusion is that life skills development and maintaining a healthy lifestyle, as trite as that may sound, can yield by far the greatest happiness, even for those suffering with profound psychological pain. I want to express very importantly that I've written this book for both the high-functioning and low-functioning borderline. High-functioning refers to people who can hold a job, maintain relationships, enjoy interests, and engage in the community to a reasonable extent. Low-functioning people tend to find that such endeavors are simply overwhelming or meaningless or just mystifying. Additionally, a person can be generally high-functioning, though struggle with specific issues. For example, as an undergraduate, I met a teaching assistant from Harvard who had dyslexia, and the professor insisted that he read handwritten assignments as a means to contend with his dyslexia. This was a good example of someone who was generally high-functioning, though low-functioning in a very specific area that required intense remediation. So the book I've written is for all borderlines, especially because there is an overlap between high and low functioning borderline personality disorder. That is, the borderline will have good days and bad days, good years and bad years, days when sunshine seems miraculous and others when fresh air seems heinous. Sometimes it is the extremes of highs and lows that creates the greatest sense of powerlessness or hopelessness, robbing the borderline of his ability to enjoy a sense of predictability or certainty in his life. Whether the borderline is high functioning or low functioning, the functioning always occurs in the particular context of behavior, emotion, and thinking. The book that I've written, behavior, emotion, and thinking are inseparable because they influence one another as one interactive system. As a result, trying to understand impulsive behavior without understanding the immediate thought that precedes the behavior is unhelpful. Similarly, investigating a person's feelings without considering interpersonal interaction is likewise incomplete. Predicting the general course of borderline personality disorder is extremely difficult, if not impossible, though Freud suggested that past is prologue. In fact, our ability to predict children's progress into adolescence and even adulthood by examining behavior, emotion, and thinking, and even academic ability is modest at best. I was once told by a headhunter that CEOs were generally C students who showed only modest promise, yet they become invaluable because they have multiple skills that they integrate into dogged persistence. My father almost failed his first 2 years of medical school, partly because of his inability to memorize huge amount of material in medical school, but also partly because of his inability to pull himself away from NHL finals. Nonetheless, he excelled in his clinical work in medical school as a fourth-year student, and just 3 years after finishing his postgraduate work, he was offered an opportunity to lead an inpatient psychiatric unit. Thus, predicting the life trajectory of even a university student is quite difficult. Because predictability is so poor, gaining insight about borderline personality disorder and life skills is crucial, because in medicine, cures are unusual, and even more so in psychiatry, although this may change with gene therapy. In healthcare, life expectancy has been extended and the quality of life improved, not because of direct cures for particular diseases, as important as that may be, but primarily because of proactive preventive care, including the colonoscopy, nutritional supplements, infectious disease control, anti-hypertensive medications, gynecology checkups, and related prophylactic care. In the absence of a cure, improving behavior, emotion, and thinking through professional therapies and also education and life skills development is crucial for the borderline to lead a more dignified and meaningful life. In my book, I generally refer to persons with borderline personality disorder as the borderline, as syntax sometimes demands that the word borderline works better as an alternate phrasing. For example, the sentence, the borderline may find that he experiences an unstable identity, seems to work better than the person with borderline personality disorder may experience an unstable identity, because the former is, I think, a bit softer. I also use the phrase the borderline in the majority of cases to personalize the narrative, and borderlines much less often, though I hope that this does not detract from the flow of what I'm going to be presenting in the videos. It's also a sensitive issue because it reflects how the person does or does not define himself. That is, some borderlines define themselves by the disorder because it can be physically and psychologically overwhelming and energy and time consuming. Other borderlines consider the disorder only a small part of their personality or identity because they feel that their lives are filled with meaning and wonder separate from the disorder. Moreover, the pronoun he is used throughout the book, even though most people with borderline personality disorder are genetically female, and wherever possible, the singular will be used. The male pronoun is used to destigmatize how the disorder has harmed women and branded them as unstable, erratic, irrational, histrionic, and even psychotic. Moreover, men with borderline personality disorder are often misunderstood or misdiagnosed as depressed, neurotic, antisocial, or just ignored. The he pronoun is used for the above reasons and not due to insensitivity or lack of inclusivity of identity. I want to clarify again that I'm a forensic psychiatric social worker and I'm a non-practicing lawyer, to the embarrassment of my mother, with a background in political science and psychology. I accept referrals because criminal, immigration, or civil litigation lawyers ask me to evaluate cases to more fully explain a client's psychosocial history, including family and mental health issues. Forensics is a 10-cent word meaning court consultant, so that persons with special expertise help lawyers and adjudicators where the court wishes to understand various issues, including psychiatric and family matters. Immigration lawyers primarily refer cases so they can evaluate hardships that American family members will suffer if their non-American family member is forced to leave the United States. Though I evaluate other kinds of cases as well, including asylum cases, spousal abuse, competency, and so on. Criminal lawyers primarily refer cases so that I consider mitigation through a broad psychosocial evaluation to uncover anything and everything to fully explain the criminal defendant's history and how he got into trouble, and to provide a much more informed understanding of his judgment and decisions. As such, my private practice area is quite different from those who have traditional clinical psychotherapy practices or psychiatrists who rely on psychopharmacology as the primary mode of intervention. I'm hoping that this advantage, or my vantage of forensics, gives me a particular perspective and understanding about people that you won't usually find from individuals who are presenting videos in mental health, and particularly on borderline personality disorder in this manner. Many years ago, a friend mentioned that she was visiting an art exhibition by a famous Impressionist painter. She had been to several exhibits of the same artist, and I asked her what she was hoping to gain to attend yet another retrospective show. And she told me that if she learned even one new thing from one new painting in the exhibit, that it would be worth her effort. There are many books, podcasts, and online articles on borderline personality disorder, yet I'm hoping that what I'm presenting and through the big book I've written, I hope it offers information or even wisdom that makes reading this book a worthwhile journey. The truth is that after decades of research and discussion about psychological injury, psychiatric pathology, and general mental health issues, our ability to explain the etiology, that is the origin of mental health issues, is still quite limited. Because many books are available on borderline personality disorder, which are extensive and perhaps not yet exhaustive, I approach the subject with modesty and humility, and I am aware that much more remains elusive. I just hope that this book eases the pain of people who suffer from borderline personality disorder and their families and their friends. Any shortcomings that I present are really reflective of my own limitations. Finally, everything I write, everything I present is to help me clarify clinical and humanistic issues and ideas that I have thought about for a long time. Certainly, writing this book and presenting these videos has allowed me to reflect on what I have learned about people in general, mental health, borderlines, and the opportunity to share my thoughts with others is simply invaluable for my own growth. This year, I helped my younger daughter study for her biology test. I told her that when she's able and confident enough to teach the material to other people, she'll be ready to take the test. And I feel the same way. I feel that I've learned enough, although I have so much more to learn, that I'm able to hopefully relay something that's helpful to others, both individuals who are suffering and even clinical experts. So the book that I've written, it's not meant to be comprehensive. These videos are not meant to be comprehensive review of borderline personality disorder, but rather my own subjective understanding based on my limited clinical experience with clients. It is necessarily limited in scope and perhaps even flawed in presentation, though hopefully still valuable for those who suffer with borderline personality disorder. The next video will focus on the criteria of borderline personality disorder, beginning with conceptualizing the borderline personality disorder criteria.